Hi, this is Mrs. Lewicki, and I'm going to be talking to you about head injuries. Um, Head injury is described as any trauma to the scalp, skull, or brain. And head trauma includes an alteration in consciousness, no matter how brief. Over 1 million Americans are treated for traumatic brain injury every year. About 50,000 of those die, and 235,000 are hospitalized. 2% of Americans currently live with disabilities as a result of traumatic brain injury. Um, there are many causes, including firearm-related injuries, motor vehicle accidents, falls, assaults, sports-related injuries, and recreational accidents. There is a high potential for poor outcomes. Death after a traumatic brain injury occurs at 3 points. Immediately at the time of the insult or injury, within 2 hours after the injury, or within about 3 weeks after that time. We look at a couple of different things, including lacerations, or scalp laceration is what this one is, which are generally minor. They are highly vascular, so they bleed a lot, and the biggest concern there is infection. We also talk about skull fractures. Skull fractures can be linear or depressed, so in a straight line, or they can be a breast fracture. They can be simple, comminuted, or compound fracture, closed or open. So the fracture a closed fracture, the skull will still be intact or maybe occurs at one of the suture lines, and an open fracture has broken into the meninges. There's some type of a tear. Location of the fracture alters the presentation of the manifestations. Just like I said in class the other day, that the area of injury is what is going to dictate some of the symptoms. Um, so some of the symptoms include can be facial paralysis, battle sign, or conjugate deviation of the gaze. I just want to have a specific note about basal skull fractures. These skull fractures occur at the base of the skull, so they're not as easily detected. Um, they're associated usually with a tear in the dura, which makes them at risk for infection. Um, Subsequently, there will be a leak of CSF. Symptoms or signs of basal skull fracture include raccoon eyes, which is bruising on the eyelid and around the eyes, battle sign, which is bruising behind the ear, and then they may have otorrhea, which is CSF leakage from the ear, or they could have rhinorrhea, which is CSF leakage from the nose. Because they're a head injury already, sometimes we expect there to be bleeding, so we would test because we want to make sure that it's not CSF leaking. And so one of the things that we'll do is put a dressing under their nares, and we'll look for a halo sign. What happens, you have a picture here, the blood kind of centers in the middle, and then the fluid is around the outside. Or the other thing is we can collect it a little bit on a dressing and send it for glucose testing. The problem is if it has blood in it, or sorry, we can even do well, we'd send it for glucose testing. And if there is blood present, that also contains glucose, so that's not very reliable. Treatment of basal skull fracture is usually just time to heal the fracture. Mm. Minor head trauma. Generally, we look at a concussion as minor head trauma. It's a sudden transient mechanical head injury with disruption of neural activity and a change in level of consciousness. Manifestations of concussion include a brief disruption in the level of consciousness. They'll have amnesia about the event that occurred. They will also have a headache and be of the effects will be of short duration. Outcomes, the biggest thing that you worry about is post-concussion syndrome, and that can happen for 2 weeks to 2 months after the incident. They may have a persistent headache, they may be lethargic, and may show personality and behavior changes depending on the concussion. Now, there is a lot of work and effort about sports injuries and when somebody can return to the playing field after a concussion. And that is still really a work in progress. I know there's some enzymes that are released, and so they're looking at field side testing to determine whether a concussion occurred, but that's still in the works. So generally speaking, the kids are not supposed to return to the playing field until 48 hours after the event. Major head trauma, there's a couple of types of major head traumas, and those include cerebral contusions and lacerations that involve the dura or the meninges or the brain tissue. And both injuries represent severe trauma to the brain. Um, there's a couple of things. One is contusion, bruising of the brain tissue within a focal area that maintains the integrity of the pia mater and the arachnoid layers. So one way that we look at that is a coup contra coup injury. Site of the impact is referred to as the coup injury, or where that initial injury occurs. What happens is the brain then pushes to the opposite end of the opposite of where the injury is occurring, and that's the contra-coup um, impact. And so it results in bruising, petechial hemorrhage, and edema in the area of the brain. Signs and symptoms, again, will depend on the area of the brain affected. Lacerations that involve actual tearing of the brain tissue. We can get intracerebral hemorrhage, and it's generally associated with cerebral laceration. And you can break lacerations may um, tear through the meningeal layer, so you may get subarachnoid bleeds related to the head trauma. In diffuse axonal injury, you get widespread damage to the axons, and it occurs after a mild, moderate, or severe traumatic brain injury. It's referred to on CAT scan as watershed infarcts. Because of the diffuse nature of the injury, it's much more difficult to treat. The injury occurs over a period of 12 to 24 hours, and you get damage in the subcortical white matter, in the cerebral hemispheres, in the basal ganglia, the thalamus, and the brainstem. Manifestation include a decrease in the level of consciousness and an increase in the ICP. So decrease level of consciousness, increase intracranial pressure. We talked about ventriculostomies and ICP monitoring. This is the patient that would get the type of monitor that's going to monitor the amount of oxygen in their brain. They may have decerebration or decortication posturing, and they also have global cerebral edema. Complications of head trauma include epidural hematoma, and that results from bleeding between the dura and the inner surface of the skull. It is considered a neurological emergency, and they must go to surgery right away. It's usually arterial, though it can be venous. And part of that, it, sorry, you will treat it. What they will do is actually do a burr hole and remove the epidural hematoma. Their symptoms include a sudden loss of consciousness initially. They wake up and are normal and don't have any problems, and then they have another sudden decrease in their level of consciousness. Um, and it's easily treated if the hematoma is evacuated right away. Subdural hematoma can be acute, subacute, or chronic. So it can be anywhere from our little old lady on warfarin that has a fall and 6 weeks later is having signs of head injury, or our sports injury patient on the field of play. It occurs from bleeding between the dura mater and the arachnoid layer. It's usually venous in origin. It's much slower to develop into a mass large enough to produce symptoms, and it may be caused by an arterial hemorrhage, but it's generally venous. Again, the treatment is they would do burr holes to remove the bleed, or sometimes if it's a small enough bleed, they just let it reabsorb over time. Other complications include intracerebral or interparenchymal, and that's bleeding within the brain tissue itself, and that can be the result of rupture of intracerebral vessels. Size and location of the bleed is key to determining patient outcomes. So the bigger the bleed, the worse off the patient is. Treatment, again, depending on the complication. Some we let time manage. They may do burr holes, or they may have to have a craniotomy to remove the area of injury